So we have a 22-year-old woman who presents with lower abdominal pain that started 2 days ago. Today, she had 3 episodes of vomiting, but denies any diarrhea or dysuria. On exam, her temperature is 38.8 Celsius, heart rate of 105, blood pressure of 128/72. She is ill appearing with bilateral lower quadrant tenderness. Pelvic exam reveals moderate yellow discharge and uterine tenderness. There are no adnexal masses appreciated. Pregnancy test is negative. What is the next step in the management of this patient? All right, so this is a 2-step question. We need to identify the diagnosis, and then what is the management of that diagnosis. And actually, it's a little more complicated, as you'll see, but there are a few critical hints in the vignette that will help us arrive at the correct answer. So let's just go through these and see where we're at here. Let's start with answer choice C. Discharge home following intramuscular ceftriaxone and a 14-day course of oral doxycycline. So this regimen, IM ceftriaxone and oral doxycycline, is the treatment for pelvic inflammatory disease, PID, which it sure looks like this patient has. And if we go over the vignette, we see lower abdominal pain, and we see moderate yellow discharge and uterine tenderness, right? So cervical motion tenderness or uterine tenderness is typically consistent with a cervicitis. And given that there's some abdominal pain and fever, this appears to be more consistent with pelvic inflammatory disease, a polymicrobial infection. So what we're going to do here is we're going to cross out choice C, because this is a outpatient regimen, and this patient seems to be a little more sick than someone who we just want to discharge right away. And how do we arrive at that? Well, there's a really critical phrase here that we see in the vignette: ill appearing. Okay. The fact that she is ill appearing essentially is telling us this patient's going to need to be admitted to the hospital, or at least observed at minimum. Okay. So that's how we cross out answer choice C. Now let's go to answer choice D. Order a CT scan of the abdomen and pelvis with IV and oral contrast. So in PID, you typically don't need imaging of this type. When would you need imaging in PID? Really, when you're worried about a tubovarian abscess. One thing we see here, though, is that there are no adnexal masses appreciated. So adnexal masses may arrive in tubovarian abscess, may be seen as well also in ectopic pregnancy. Here we see pregnancy test is negative as well. So I am going to cross out answer choice D. So then we're left with A and B. This comes down to knowing what is the management of inpatient PID. And ciprofloxacin and metronidazole, that is not the standard treatment for PID. That may be the standard treatment for diverticulitis, right? So that's not the case. And we're left with A. Admission, which is where we should go, as we talked about. She's ill appearing, she is vomiting, right? She's at risk for dehydration. And IV cefotetan, cephalosporin, and doxycycline. So PID, you're thinking things like dysuria, you're thinking chlamydia, you're thinking even Gardnerella vaginalis, you're thinking E. coli, anaerobic strep as well. And so I'm going to go with answer choice A. And sure enough, that is correct. Admission for IV cefotetan and doxycycline. Hey everyone, before you go, if you're interested in your own QBank, whether you are an MD or DO, a PA, or an MP, simply go to roshreview.com and sign up for a free trial. See if Rosh Review's content is right for you. Keep learning, keep working hard, and always have a sense of mission about your work. Now is your time. This is Dr. Adam Rosh signing off.